Hi, welcome to License to Spill. I'm Christina Scaglione,
And I'm Julie Stark.
and we are hoping to go over a new podcast with you guys today. We want to talk about therapy speak, decoded.
Exactly.
So,
Exactly.
to be really clear, what we mean by that, the intention of the episode, before we go any further, it's not about invalidating people's experiences or people's pain or minimizing their experience. It's about talking about how language shapes the nervous system response and how using clinical terms inaccurately can actually make people feel more distressed and not less. And I think most people, they're not misusing the therapy terms on purpose. They're doing the best they can with the information that they have. And I think that's kind of what started the conversation between Julie and myself around why therapy words are misused and how often they're used and just kind of thrown around. Julie came up with the idea for this episode.
Yeah, absolutely. You basically just said everything that I was going to say.
Oh, sorry.
But I think you're right on, and I hate to label people in age groups, but it feels mm, like the 40 and under crew are using these words,
Yeah, I
and
feel attacked.
it say that again. You feel attacked, great. Well, I'm 51 as of yesterday. Um,
Happy birthday.
Thank you. To your point, there's a difference between pathologizing these words and also validating when someone does have some mental struggles, and we have to find the in between. And I don't want to say that age group, but a lot of people will say things such as, oh my God, my PTSD is so bad, I cannot walk back into that restaurant, when it could be something much simpler. Or I am so depressed. My boyfriend and I broke up. Well, how do we know it's not sadness? And there are clinical, I can't think of the term, like not diagnoses, there are clinical criteria that will lend themselves to a diagnosis. And I think these terms are just being thrown around: anxiety, trauma, PTSD, OCD, depression, all the time. What are your thoughts?
Something that we notice in our practices with our clients is that clients come in using really big clinical language right away, and they're trying to describe what you just said. PTSD is acting up, and there was another example that we were talking about last night that you said it wasn't PTSD as the example. I think it was like OCD. My OCD is
Yeah,
acting up. This is really activating X, Y, and Z. Whatever it is. My point is you can put in any terms in whatever is being used to describe how the client or person is feeling. And I think what it really tells us is really important. That person or those clients that we see are really just trying to be understood, and they don't know the words or language to use in order to feel understood. So they grab at whatever is currently. I made the comment when we had the conversation prior to recording. I said it's like online or internet buzzwords, social media lingo that's being passed around
whether it's
as
on Instagram, Facebook, TikTok,
yeah,
any
it's
platform you can imagine, it's
yes.
there.
And they're using people, and it's not necessarily our clients, but people are using words that make situations feel more severe or catastrophic than what's actually happening in the present moment. When your nervous system believes that a threat is extreme, it responds accordingly. So it's almost like you're making it worse by the language that you're choosing.
Absolutely, like a self-fulfilling prophecy, yes?
Definitely. Definitely. Yes. And there could be a lot of ways in which you navigate it differently, speak more accurately, and have a better understanding of the language that you're misusing, so that this way you don't make your situation feel worse. You can feel
Live in that
understood.
identity.
Yes. And that's important too, living in that identity. Feeling distressed doesn't automatically mean there's a disorder. It's that simple. Right?
Yes.
So you
Yes,
said
and
depressed.
that's more, yes, that is even more simplistic, than I was saying, but a good one. And at the end of this podcast, we can give some ideas for people. We can give them this emotional literacy like you were talking about, because we never learned emotional vocabulary, and that just blows my mind. This
I
is
like
why
that you said
this
emotional literacy. That's a perfect way of saying it.
right? And I think that is why a lot of this is happening, because people don't know the words to choose to say, like you're saying. So an example, like, I'm depressed. If someone is saying that, what they can say instead is, you know what? I'm going through a really tough time right now.
Or I'm feeling sadness, like you said earlier in your example. I broke up with my boyfriend, I'm feeling depressed. Maybe it's just sadness or even it's complex grief. You know, there
Yep.
can be lots of different layers to things. And I think a clinical diagnosis, the language that we're trying to help people understand, clinical diagnoses exist for a reason. Not every emotional experience equals that or needs to be medicalized
Pathologized. Yeah.
to that
Right.
to be valid in order to be valid, and that's the important part of it. I feel like people use strong language to feel validated in that experience, and what we're trying to explain is you don't need to in order to feel valid. You don't have to
But,
catastrophize it to feel valid.
but I think that sometimes, and I really don't like to label people, but there are some people who feel so much better once they do have a label on whatever it is that they're experiencing, right? So
Yeah.
they can feel seen and feel heard and think, wow, I'm not crazy. Like this actually is a disorder. So in no way are we trying to minimize mental health. In
No,
fact,
but
we're
we're
just
also
trying to provide tools to be
we're
accurate.
that yes, and I think that there's something to be said about de-escalating a story and not amplifying it to get your point across. I think we're really talking to the masses that misuse these words that we're going to go through as examples. We're trying to explain the majority of people that are expressing things are doing it in a way that could be harmful to the people that actually have those disorders and can further marginalize individuals that struggle with these issues every day and not accurately explain what it is that you're feeling. We want to help people have the right language for that. And we also want you to understand that maybe certain words and terms shouldn't be in your common vocabulary because that's not what's truly happening for you. So we're going to clarify things without shaming. I guess that's the best way I could explain it. One term that we can go over that I think we both hear a lot is I'm so OCD.
So yes, so people often say I'm so OCD. And usually I hear that as a derogatory self judgment. And that could mean they're stressed out and they're organizing their desk to look good, or they're cleaning something over and over again and will embarrassingly say to someone else, yes, this is my OCD, and try to validate what they're doing. When in fact, that's a coping skill
Hmm.
to something else,
Yeah.
right? So that's a difference that has to be discerned.
Right, right. So clinical OCD is not about preference. It's about the intrusive thoughts and compulsions that cause significant stress. That's not the same thing as I want my desk to be tidy.
Well, that's the behavior. I guess I'm talking about more about the compulsion.
When somebody deploys a coping skill for stress that they're feeling, that's not equal to the same coping skill that someone with OCD would be deploying for the same or similar distressing experience. Could both a person without OCD and a person with OCD want to tidy their desk?
Absolutely.
Would it be stemming from the same issue?
No, stemming from the same issue. It just
Correct.
depends on, right, on how they use the terminology. Someone
Right.
just cleaning up their desk might not have a mental struggle.
No, exactly right. So clinical OCD isn't about preference. It's not about, I always want to clean my desk when I'm feeling stressed. OCD is about the intrusive thoughts and compulsions that cause significant distress. Those two things
What do
create
you
that.
mean when you say preference?
I like a clean desk as a preference, and having an intrusive thought and compulsion to clean the desk is different. So liking things neat
So-
doesn't make it a pathology. Preference is
exactly.
not pathology, is my point.
Correct.
So
Correct.
using the term OCD casually can actually minimize how debilitating it really is for people with truly struggle with it.
You're right.
That's what I meant by preference, just to kind of
Okay.
give you like preferences in pathology.
Understood now. Thank you.
What's another term that you hear a lot of misused?
Depression and anxiety are huge, but also trauma, 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 trauma,
I love that
trauma.
one. Trauma and PTSD. It's kind of smacked together. Why does this one matter?
This isn't about invalidating anyone's feelings, right? Pain is pain. Language matters, especially when it comes to mental health. There's a difference between experiencing a symptom and having a clinical disorder, right? And uh, we can talk about mental health seriously without medicalizing or pathologizing every human emotion. Not every painful experience is a diagnosis. Sadness, fear, and heartbreak are part of being human and not always a sign of pathology. Again, just like we were speaking to a moment ago. And we've started to use clinical language as emotional shorthand. I think that was what I was trying to say before when I was talking about emotional literacy.
Yes.
Saying I have PTSD from my breakup versus this relationship really hurt me and certain places bring me back to that feeling. And someone else will agree, yeah, totally PTSD. And again, it just reduces its definition and what people actually suffer through. And it's just used as common language.
Echoing what you already said, trauma is one of the most overused terms right now, and it's also one of the most misunderstood. What you express as far as every painful or uncomfortable experience, not every single one of those experiences is trauma. Trauma clinically involves a threat, a lack of safety, and a nervous system that gets overwhelmed in a way that has lasting effects that interrupt somebody's ability to live comfortably and smoothly. When everything is labeled trauma, the nervous system stays on high alert, and then the healing becomes really hard for the individual.
And
It's not
and
easier.
and the word starts to lose its meaning.
It does lose its meaning. And you can honor pain without having it turn into a diagnosis. And as somebody who was personally diagnosed with PTSD in college, it's not something that I like that people misuse all the time. Everybody walks around thinking like PTSD is a badge to wear of what I've been through, but it's as somebody who's spent a lifetime recovering with that diagnosis and having to learn so many different types of ways to live my life in a more fulfilling way. I don't appreciate when people are like, "Oh, this is almost as casual as I pick Cheerios out at the supermarket."
Exactly. Exactly. It's I think again, social media, TikTok especially,
Yeah, sorry, Tic
really
Tac.
yeah, really calls out to mental health. And I have clients who come
Yes.
in all the time. And
Mhm.
granted, there are some really great things on TikTok. There really are. But please don't get your medical advice from TikTok.
I know.
See someone who is credentialed to see you.
Yeah.
Um, they can have some great quotes that can help you or different coping skills, but this is where I feel like it's coming from the most, not TikTok, just social media.
100%. And to your point, there's two that really stick out for me that are more popular than the two that we just discussed that I see all the time on social media. And I have recently been trying to create some content for our accounts to clarify what it really means to experience a narcissist. That's a really popular one.
That's like
And
another podcast, but go ahead.
it is another podcast, but just for the sake of terms, narcissists and attachment style are just at nauseum on social media. I know that this might be an unpopular opinion, but attachment style is not an identity. So I just have to say it.
Okay, okay. That's one I haven't heard as much.
I have had clients that have come in and been, "What do you think my attachment style is?" Then they give me their version of whatever they read on social media, and my eyes cannot roll harder. I Attachment style is meant to describe patterns, everyone, not
Right.
define who you are. I just want to say that. Coupled with attachment style is coupled with whatever zodiac sign they are, and that just makes me want to like hit the huge. I can't. I feel like either a big cartoon anvil has to drop on my head when I hear that stuff, or
With a
someone has to
cartoon.
exactly. I hear clients say things like, "I'm anxious attached. So this is just how I am now."
Yes. I haven't heard those, but
Or,
yes.
I'm an avoidant attachment. I just can't do relationships. Like, no, Barry, you're not working at the right stuff.
Barry. That's hilarious.
I know.
And you're right. And they read something and something resonates with them and then they are this
I
versus
know.
I have this,
And
right?
that's incorrect because attachment styles are fluid. They're fluid. You're not stagnant in an attachment style. They change. Alert. Attachment styles change with safety, awareness, and experience. They can move through life with you and develop and change and swap. It's not like whatever you experience
Absolutely.
at 8 is gonna be the way that you are for the rest of your life.
And I think you and I can talk like that, but how do we get the word out to the common public that just because something resonates with them and they read it that they are that, right?
Oh, so here, great question. I think if something resonates with you, let's explore why, as opposed to let me take that now and put it on my social media profile next to my pronouns.
And when you say let's, though, you don't necessarily mean come to therapy because there are a lot of people who can't afford therapy or don't want to come to therapy, but we want to give
I
them some
mean,
questions they can ask themselves.
I mean explore it in therapy.
Okay.
So maybe,
Okay.
I don't always buy into the I can't afford therapy bit. I think that a lot of people can afford things that they want, and they just have to understand where the need
Tangible
is in
things.
their life. Tangible
Ta-
things, sure, tangible.
yeah.
But what could be better than investing in your wellness? In my opinion, like what could be better than that?
Nothing, in my opinion. Nothing. But, survey 10 people on a Manhattan street and you're going to get a lot of different answers.
But I bet you I won't get a lot of different answers if I ask everybody what they think their attachment style is. I'll probably get very similar answers of how they think attachment style explains their behavior. It might explain your behavior, but it doesn't excuse it. And I think that's the part where people they there's a drop, right? They drop off the cliff right there. It might explain your behavior, but it doesn't excuse it, and most people will use it to excuse it.
Ooh, I like that. Use it to excuse it. It's
Almost as
like
much as I
name
love
it to
emotional literacy.
it's like name it to tame it.
I'm going to swap over to the other really popular term that everybody I feel like I explore this topic a lot in my sessions, and I love my client base. I'm so lucky with the clients that I have worked with in my career up until now and into current. I've had such a wonderful experience in private practice with the people that I've worked with, but I feel like this term comes up pretty frequently, and it's the term narcissist. I mean, Jules,
If
you know how I
anything
feel about this
if
topic.
anything, that is the word that comes up, and it is confused with personality disorders, you know, having narcissism, being diagnosed with an NPD,
Mhm.
and a narcissistic person,
Mhm.
all yes, so common. Go ahead with what you were gonna
Oh, I
say.
was just gonna say it's probably the most misused term that I hear. If I had to pick out of like all the ones that we've covered so far, it's the most misused. And when I talk with clients or people, it could be anybody that I'm having a conversation with it, this comes up. What I usually say is I can't diagnose that person, but what I'm hearing is whatever it is that they explained. And then I will say it is very possible for people to have narcissistic traits and not be a
Right,
narcissist. And
absolutely.
people are often surprised by that statement.
Yeah, like, what?
Like, how can you have some without all of it? Not every hurtful, selfish, or emotionally immature person is a narcissist.
No, you're right. You're right. And these traits have to come together with other things to be given a diagnosis as such.
Correct. I think it's funny if we had our colleague Christina Scheinberg on with us, she would say, "Oh, this is when I like to whip out the DSM and let's see if you group together all the right things to be what you think you are."
Yep,
And I think
absolutely.
to her point, narcissistic traits are not the same thing as a narcissistic personality disorder, like you just highlighted. So when we label everyone as a narcissist, we lose nuance.
100% agree. 100% agree.
And so,
And then like I said before, people will go onto social media and say, "This is what my boyfriend does. Am I dating a narcissist?"
oh, I love that. That's like a Reddit hole that people go into.
And there's just, millions of people on the internet saying their stories
Billions.
and
Absolutely.
and some are similar and some are not, but you can't get your information from social media with regard to you and what you're experiencing.
And sometimes it's helpful, like not to shame social media, but sometimes it's helpful to have a community, which is why I know people go to the internet for community because in a world that is extremely modernized, we sometimes can't find connection. So internet has been helpful for that. But when we lose nuance, what I was saying before, sometimes we lose the ability to understand what actually happened. You give us what your perspective was, which is helpful, but then we lose some of the things, details that would help us better understand of what really happened. So when I'm working with clients that feel that they've been the target of a narcissist, I do a lot of groundwork to try to understand what's really going on in that person's life to see. And it's not important to diagnose the other person. What's important is to understand how the person's perceiving,
Reaction to it,
yeah, the
right?
lens that they're using to go through it, right? You can hold someone accountable without pathologizing them.
Absolutely. That person might not hear it in that way, but that's on them and not on you.
Right, right, right. How do you think language can escalate the nervous system or even de-escalate? You've said it not exactly like this, but we've already touched on this in the beginning of our podcast, and that is that language isn't neutral. Language can either amplify a situation or it can help us better understand a situation.
Are you
The
talking about
words
us as the therapist or us
people, as
people?
people, as humans.
Okay.
I've said the words that we use tell our nervous system how dangerous something is or how we're going to be experiencing something. So it's extremely important to be intentional with our words.
Yes. Yes. And to learn the definitions to your point so that they can choose different language,
Right.
right? Because if you like fire alarms, like we've talked about,
Yes,
right?
exactly. Exactly.
Uh,
Talk about the fire alarms.
Fire alarms don't necessarily mean a fire is happening every time the fire alarm goes off, but your body can react as if there is a fire and, get all hyper and anxious and need to get out and fearful and, tachycardic and
Mhm.
shortness of breath. And
And how does that happen?
based on what we learned when we were younger of what something meant
Mhm.
or how we've, yeah, that's how I would define it.
So when the language is extreme, our nervous system reacts as if the threat is extreme.
Yes. Yes. It's a
One of the
better way of
you
saying
use
it.
fire alarm, and so I've used fire alarm as an example. I usually say it's like a hardwire response that we can't turn off, which is why when people say that they have anxiety, I said, okay, welcome to being alive, because all
Right.
of us do. It's part of what's kept us alive for all of these years. When it's mismanaged, it becomes a problem, but we can't really remove it entirely, and it's part of our fire alarm system.
And it's necessary.
Correct. And one of the things that I use as far as how language plays a role in the fire alarm system is I tell people, your nervous system cannot tell the difference between a Tyrannosaurus Rex running through the wall and you having test anxiety. It doesn't know the difference. What it knows is what you tell it based
Right.
on the symptoms that your body is feeling. So if you explain to yourself with the appropriate language without amplifying the situation and keeping it truthful, so like choosing non-dramatic language to
Yes.
describe what they're feeling. It will give you a better opportunity to be able to get through that distressing example versus having a panic attack.
Agreed. Absolutely. But that takes practice, right? And it takes
Totally.
intentional speaking,
Mhm.
like you're
Mhm.
saying.
Yep.
And people want that to happen like this once they understand it. It doesn't work that way. It has to be
Exactly.
sort of titrated down and practice,
Exactly.
practice, practice.
Exactly. And how it ties into what we're talking about today is sometimes therapy language that's being used in a way that is inappropriate keeps someone dysregulated.
Agreed. I'll give you another example that might not be what we're talking about, but I'll ask a client if they're experiencing a lot of anxiety to stand up in my office and jog with me for 10 seconds because that's
Like in
probably my
place.
limit. Yeah, to jog in place, not leave the office. To jog
Where
in
are you guys
place,
going?
to jog in place with me. Unfortunately, I do it with them, and then we sit down. uh, I will ask them, "Tell me everything that you're feeling right now, head to toe." And some people might say, "Ugh, I can't believe it. I'm embarrassed, but I'm a little winded." Or my heart is racing so much. I'm hot. I'm sweating. And so forth. Right. And those are the same feelings that they'll explain to me that they're feeling in another situation that gets them so scared that it leads to panic. But the symptoms are exactly the same. To your point, when you're talking about interpretation, it's how we interpret it. It's how we interpret it that matters the most. You can remember, oh my gosh, I felt the same thing as I was jogging in place. versus I'm about to have a conversation with someone and I might get fired or I have to fire somebody or whatever it may be, and it not escalate to panic is my point.
That's a good example. Thank you for sharing that. When someone sits in front of you and wants to describe to you what they're feeling, and they'll say they have a tendency to be somebody who will use a lot of buzzwords. Are you listening for buzzwords to address what's coming up, or are you listening for something else?
That's a difficult question for me to answer because I'm hearing all of it. I am, if they say, a buzzword once or twice, I'll note that. But I also want to know what's going on behind it and how they're responding to something. So,
Absolutely, and that's a great way as a therapist to be listening for that, and I think my point in asking that question is the buzzwords aren't really important at all. What we're listening for is emotion, pattern, and meaning, and where their nervous system state is. So we're listening to all the other things, so it's not even important to us that you know these buzzwords to come in and share them with us because it's not even
absolutely.
clinically what we lead with.
Absolutely.
So we
Absolutely.
care less about the terms, people. We care less about the terms and more about what's happening underneath it.
Right.
What we're doing as therapists is we're listening for emotion, pattern, meaning, and where your nervous system state is. We're not listening for buzzwords. So we care less about the terms that someone is using and more about what's happening underneath, which is why when Julie said she's listening for all of it, I was saying that that's a skilled therapist will be listening for all of it and will be looking for what's underneath it because the buzzwords, they don't mean anything to us. The label doesn't guide the work, the experience does.
Absolutely. And that's what I don't think the common person has learned yet. And people don't usually walk around saying, I know my patterns. I know my patterns. They think it's something else. So
Yeah, so you know you're
you
an
and I
asshole, but
listening
you
to
don't
it and
understand why.
say that again.
I said,
We
I'm
talked at the same
picturing
time.
somebody like, I know my patterns. I know my patterns. Do you really know why you're an asshole? Or do you want to get to the bottom of why?
Great way to say it.
You know?
Great way to
So
say it.
is there, and again, like this might be a question that we develop an answer to now that I ask, but do you think that therapy language can be used in a healthy way?
Yes, I do. Once a client or person knows the actual definition of it and can choose other language when necessary and choose therapy language when necessary. I think a lot of people also take pride in learning some of this emotional vocabulary, even if they're learning it wrong, they want to say it because everybody else is saying it.
That's a
So,
good point.
right?
Yeah.
So I think I think there's a place for it.
Okay. Healthy therapy language could potentially increase clarity and not fear. And it could help people describe what's happening instead of locking them into an identity if it's used
Exactly.
properly.
That's what I was saying earlier, into an identity. Yes. Yes.
Great. Some examples that we can say out loud of, let's say, descriptive language that's useful other than diagnostic language. And you used it earlier in the podcast recording. So what I'll say now is like something similar. I feel overwhelmed
Right.
is a really descriptive way of describing what's happening, or I feel shut down,
Exactly.
or I get
Exactly.
anxious when, and then fill in the blanks.
Yes, and there are so many different things that can be under labels like depressed, anxiety, trauma, etc. And you're right. It doesn't usually it doesn't allow the person to feel as heightened if their language is reduced, not necessarily minimized, but reduced because it doesn't mean what they think it means.
100%. And I think we said it before. I'm just going to repeat it again. Not everything needs a diagnosis to be valid. You could have an experience that's valid without a diagnosis attached to it. So, mental health language is meant to support healing, not dramatize the suffering that you experienced.
Of course, not to dramatize it. Yes. Yes. And I also think, and I've said this in podcasts or videos before, if we can look at things with curiosity instead of shame or instead of other things, we can open up our world to actually ask ourselves questions like, why am I diagnosing myself? Or what is it that I'm feeling? Right? Does that
Yeah,
make
those are great
sense?
questions. Yeah, those are great questions. Yeah,
I
absolutely. Or let's slow this down for a second and re-examine it from a different perspective. Or, in session, if we hear somebody running a tangential, explanation of what they think is going on and they use a lot of dramatic language from a clinical perspective, we could share why that matters more because of what is underneath that. And we're able to guide people in that way. But if you take nothing else from this episode, I hope that you take this. And this piece is that you don't need bigger language to help us understand what you're going through.
Exactly. And the last thing that I'll say is another thing that we can ask ourselves is, does this label help me cope or does it make me feel stuck? And then go from there.
Yeah, absolutely. Absolutely. Thank you guys for joining us today. Like, comment, share, subscribe, follow us on socials for more education on how to properly use language and or identify emotion. Emotional literacy, I think, is a great phrase that Julie
It's why
said
we have
today.
that emotions wheel that is incredibly helpful.
Yeah, it is. Absolutely. Thank you guys for tuning in.
Yep. Thank you. Ciao.